what is that? The blood vessels of the upper limb and lower limb, and as well as the coronary arteries. Okay, it's together. So had even did you have the lecture about the upper and lower limb vessels?
You gave us.
No, you gave us only the coronary.
Yeah, you will have it maybe tomorrow or day after
How
tomorrow.
can we take the lab before the lecture?
I don't know. Just talk to Dr. Jamal. Because I'm not responsible. What are the things
Yeah,
which
I
are
know,
assigned to
I
me?
know, I know.
I'm doing.
Yeah.
That's it. Okay. That should not happen actually.
Yes.
Okay, so begin with the coronary arteries. Already told you in the lecture. So there are two arteries, the right coronary artery and then the left coronary artery. Both they begin from the aortic sinuses. The right from anterior aortic sinus, the left from left posterior aortic sinus. So I'll just show you these vessels. This is the heart, right? Agree? Okay. So this is the right border and this is the lower border. This is the apex. This is the left surface. Clear? This is the sternocostal surface and this is the inferior surface or the diaphragmatic surface. So you can see here the beginning of the right coronary artery. This is the right coronary artery. Anterior aortic sinus. This is the aorta. Okay. It runs downwards where anterior, right anterior coronary sulcus. This is what is the sulcus. That is the atrioventricular sulcus, are also called as coronary sulcus because of these vessels. Okay. So it runs in the right anterior coronary sulcus, runs towards the lower border, or you can say junction of the right and the lower border here, and then winds round. See, it winds round and then goes posteriorly, and then goes posteriorly. This is what is the crux area. This is the crux area.
Crux, yeah.
Okay, so it's anastomoses with the left coronary branches. Here further part is not shown, so not I think it's not there. I think cut or maybe in the deep. Okay, it will anastomose with the left coronary artery branches. Okay, at this area. Okay, so now coming to the branches. So I told you the first branch will be SA nodal branch. You can say this is what which is going posteriorly, which goes between the aorta and then the superior vena cava here. Okay, down between, you can say, the atria or the auricle and then the ascending aorta, and then goes and then supplies the conducting system, mainly the SA node. And next comes the vessels, which are, this is what is the infundibulum, right? Okay, so these are all the infundibular branches supplying the right ventricle. And here actually you will get a big vessel, that is the marginal artery. So I think better seen in this. You can see it here. This is the right coronary artery, right? These are all the marginal vessels. These are all the infundibular vessels. Okay, this is the marginal artery. Clear? So some part is not shown here. Okay, so it's not there. There will be variations. It's not exactly like whatever I say. It will be there. It won't be there. So there will be variations from person to person. As I told you, the posterior interventricular or posterior descending artery is majorly from the right coronary artery in 60% case. In other cases it will be different depending on which cadaver is taken out, like that. Okay, so here you can see even the right coronary is supplying the left ventricle also. It is unusual. Okay, the more coronary dominance, you can say right coronary dominance. This is the posterior interventricular or posterior descending artery or posterior interventricular artery. Okay, so even much of its branches even supplying the left ventricle also here. See here. Usually it has to be supplied by the left coronary artery, but here one of the branches is even going further and then supplying the left ventricle also. Okay, so the more right coronary dominance. Clear? So this is what is the right coronary artery. And come back to left coronary artery. See here, as I told you, the origin of the
Between
that is the left coronary is not much seen on the anterior side because of the overriding of the pulmonary trunk. Okay, so because of this, the even left and even about the left auricle, the left anterior coronary sulcus is not so distinctive as compared to right anterior coronary sulcus. Okay, so it is here the origin. Okay, runs downwards. First branch it gives says this is what is the anterior descending artery. See this? This is the anterior descending artery which is running in the anterior interventricular sulcus. Okay, the anterior descending artery or left descending artery. There are many names.
Yeah.
So if you go to clinical side in X-rays, angiograms, they say LDA, PDA, LMA, like that. So what is LDA? Left descending artery. LMA, left marginal artery, then diagonal artery. then we call this as PDA, posterior descending artery. PMA, that is what is that? RMA, right marginal artery. LMA, left marginal artery, like that. Okay, the different names.
Which artery that supplies the apex?
Yeah, there will be anastomose. See here, this is the anterior descending. Okay, the posterior descending. They are anastomosing both from these vessels, both right and left. See here, this is the anterior descending. Agree?
Yeah.
Okay, and this is the posterior descending. They are anastomosing. Okay, so they will anastomose near the apex area, and these are the marginal branches and then the diagonal branches. See this, the marginal artery, you can say this is the diagonal artery. Okay.
Apex is supplied by twice.
Yeah, because here there is anastomosis. See the anterior
okay.
descending and posterior
But we said
descending.
anastomosis only anatomically.
Yeah,
But
anatomically.
Functionally,
Outside you can see the anastomosis, no? See here. But functionally you can say it as much of the left ventricle is supplied by the left coronary artery. So apex is formed by the left ventricle, it will be supplied by the left coronary arteries. Okay? Yeah. So the marginal artery, left marginal artery, and then the diagonal arteries. And the other are the ventricular branches which is supplying the left ventricle. So the important branch from the left coronary are the anterior descending, then marginal, and then the diagonal, and rest of this artery. So after giving this, if you lift this, it is very hard. If I lift it, it will break. The rest is continuous as the left circumflex artery, LCA, left circumflex artery. So from left circumflex only, these are all the branches. This is what is the left circumflex which is running. Okay, I can think you can see it here. Yeah, this is what is the left origin inside. Okay, this is the anterior descending. Okay, this is what is, you can say it as the circumflex artery, which is giving the marginal as well as the diagonal branches. Continuation. This is what is the circumflex artery. Okay, and this is what is the coronary sinus, the blue one. This is the coronary sinus which is opening into the right atrium. Coronary sinus. Here in this you can see the coronary sinus which is cut here. See this? This is what is the coronary sinus. What is this? This is the, can you see it or not? See here, which is cut here. This forceps will go into the right atrium. This is what is the coronary sinus. Coronary sinus. Okay, coronary sinus, which is formed by, this is, you can say, the oblique vein of left atrium. Oblique vein of left atrium. And majority of it are cut. You can see it here. The vein which runs along with the posterior interventricular is which vein? Middle cardiac vein. This is what is the middle cardiac vein, which is joining the coronary sinus. The middle cardiac vein which runs along with the posterior interventricular artery, middle cardiac. Rest of the veins are cut to show you only the arteries here. Okay.
Doctor, on the left side it is the aortic sinus, and the right side it is the oblique vein. Okay.
Coronary sinus, not
This
aortic
coronary
sinus.
sinus?
Yeah.
Yeah, coronary sinus.
Okay.
And then the right side it is the oblique. This is the oblique.
Yeah. Yeah, you can say it like this is the oblique because the opening is here. Okay. Yeah.
Which the artery that surrounds the heart that is, I think, right coronary?
Both surround like this. With both they go back. Right also goes back by winding around the lower border. Left also winds around the left surface, goes to the posterior side where they meet at the crux. Okay. See here. So this is also, actually this is cut into pieces. Okay. So this is also right. It goes round here, and even the left also winds round. Both on the left side, and there was the right side. So here the right side is not dissected. Okay, it's all fat. So this is what is the right coronary artery. See here. Okay, which is going posteriorly. This is what is the middle cardiac vein. So the vein which runs, this is what is the great cardiac vein. The great cardiac vein runs along with your anterior descending or left descending artery. The vein which runs along the left descending artery is the great cardiac vein. This is the great cardiac vein. Okay. The vein which runs along with the posterior interventricular or posterior descending artery is the middle cardiac vein. And the vein which is along here, you can say it here, this the small cardiac vein. Not much clear here. You can say in this model. So this is what is the anterior descending, right, or left descending. This is what is the great cardiac vein, which is joining the coronary sinus. Okay, and then here this. So this is what is the the small cardiac vein, which is joining the coronary sinus. This is the middle cardiac vein. Small cardiac vein, okay, which runs along with the right coronary artery, okay. The middle cardiac vein, which runs along with the posterior descending artery, and the great cardiac vein, which runs along with the anterior descending. 3 cardiac veins: great, small, posterior. Middle. And this is what you can say the posterior ventricular vein. Posterior ventricular vein. So, which are the tributaries of the coronary sinus? Tributaries of the coronary sinus: the posterior ventricular vein, great cardiac vein, small cardiac vein, middle cardiac vein. Clear? All these join to form the coronary sinus, which opens into the right atrium. Okay. Other than this coronary sinus, there are other veins. We call them as anterior cardiac veins, which directly open into right atrium, and the vena cardis minimi. Vena cardis minimi. So this is about the coronary vessels. So anything can be marked, like this vein or this artery, okay, or this artery, like right coronary artery. What are the branches? What is this? The great cardiac vein. Great cardiac vein. So where it joins? It joins the coronary sinus. Where does it open? It opens into right atrium, like that. Okay, what is this artery? What is this? Left descending artery. Okay, it's a branch from left coronary. What it supplies? It supplies the anterior 2/3 of your interventricular septum and even the adjacent sides of right and left ventricles. Like that. Any questions may be asked, and even the identification also. Right coronary artery, left coronary artery. Okay. So any doubts in this coronary vessel?
It's the right and
Yeah.
it's the left.
Yeah. This is the left inside. Okay. This is the descending.
Yeah. The descending is the anterior interventricular.
Yeah. Left anterior descending, that is posterior descending.
Yeah.
PDA, LDA. And this is circumflex going.
So for it is not seen behind the.
You can't see this. Its auricle is behind. Behind the auricle, you find is the left circumflex. You can say this as the circumflex. After giving this you can say it as the circumflex. Okay. So this is about the heart, there is the coronary vessels and then the veins. So now let's move on to the upper limb vessels. So I already learned that the upper limb is supplied by, I told you last class.
Upper limb.
Yeah.
The.
No, that means the partly told you, no, like the subclavian
Subclavian.
continues as axillary and then supplies the upper limb.
Yeah.
So give me a pen and paper, I can explain it. Pen. So I told you this is the right side brachiocephalic, okay, which divides into subclavian and then the common carotid. Right, left side, left side, it is the direct branch from arch of aorta, left subclavian. Clear? So this subclavian runs the root of the neck divided into 3 parts by which muscle? Everything.
The scalenus.
Scalenus.
Scales anterior.
Yes, very good. It's the scalenus anterior which divides it into 3 parts. First part, second part, third part. Okay. So after this continuation, it runs behind the first rib. Okay. Behind the first rib. So from the first rib, outer border of the first rib, the continuation, the same artery, subclavian artery continuation further is called as axillary artery because it lies in the axilla. Axillary artery. All your first year knowledge, okay? Axillary artery. So after exiting from the axilla, it goes to arm. Then it is called as, what is this called as? In the arm?
Radial.
Brachial artery.
Brachial.
So up to here, this is the axilla. This is the axilla. This is arm. Okay. So from the arm, it runs downwards at the cubital fossa, at the head of the or neck of the radius, divides into
Radial
and ulnar. Okay. And then both they run downwards. The ulnar gives one branch here in the forearm, that is important. That is the common interosseous artery. Common interosseous artery, which in turn divides into anterior interosseous and posterior interosseous. Okay, I will come to that. Wait. So now wrist joint, they cross both radial artery mainly goes posterior side, ulnar artery runs on the palmar side. Okay, ulnar artery forms superficial palmar arch, okay, completed by a branch from the radial artery. Okay, and then radial artery further it goes posteriorly and then forms the deep palmar arch. So it should be like this. Okay, completed by a branch from ulnar artery like this. This is the superficial palmar arch and this is the deep palmar arch. Okay,
Again, doctor.
yeah, the subclavian artery, okay, from the arch of aorta on the left side, brachiocephalic on the right side, runs at the root of the neck, divided into three parts with scalenus anterior, then crosses the first rib, okay, from the outer border of the first rib till to you have a muscle called here called as teres major. The lower border of the teres major is the axillary artery within the axilla. So from here to here it is the axillary artery, and then enters the arm, and then enters the arm. It is called as the brachial artery. First it is on the medial side and then comes front at the cubital fossa here in front of the elbow at the neck of the radius. It divides into radial and ulnar. Radial on the thumb side, ulnar on the little finger side. Both they run downwards. The ulnar artery here only front, it enters into the palm, whereas radial artery it goes posteriorly, and then on the dorsal side it goes deep, whereas ulnar artery here it forms superficial an arch like this, that is called as superficial palmar arch, completed by a branch from radial artery. Okay, arch means it has to be complete. Okay, so ulnar artery goes like this and forms an half of arch, completed by a branch from radial artery, whereas radial artery after passing back on the dorsal side enters between this and this finger, okay, deep, goes deep, and then forms deep palmar arch within the palm, deep. I will show you where, deep palmar arch, okay, and that is completed by a deep branch from ulnar artery. An arch is like this, it is arch, okay. So now the superficial palmar arch, it is mainly by the ulnar artery. It has to be completed. Something should come and complete the arch. A branch from radial artery joins this arch, forms the complete arch, that is the superficial palmar arch. Whereas same arch in the deeper aspect, the deep palmar arch, which is formed by mainly the radial artery and completed by a branch from ulnar artery. Clear? You can see it here. So see there? See this? This is what is the palmar arch. Okay, I can show you the better. Where is that? Yeah. What is this? This is the little finger side. See here. Little finger side. This is the thumb side. So here is the radial artery. And this is the ulnar artery. See here, it is going in front. Okay, this is the palmar side, this is the dorsal side. Okay, so it is going and then forming an arch. See here, this is the arch. This is not an arch. You can make it or not, arch. It is like this. Okay,
Okay.
This is the arch. See here. From this arch, the vessels are running. Okay, this is the artery. See here, trace it.
Yeah.
Okay, completed by the branch from radial artery.
So the superficial mainly by the ulnar and
Deep by radial. Okay, I can say the deep, this as the deep because all the tendons are cut. Okay, this is what is the deep palmar arch. See here, this is the ulnar artery which is cut here. One of the deep branch is going and then completing the deep palmar arch, whereas this main artery it is formed by this what is that, radial artery. See here, radial artery is going deep. See here, the radial artery. This is the radial artery. Okay, winding round and then going deep. See here, this is the radial artery on the dorsal side. It is going piercing here and then coming here and then forming the deep palmar arch. Here all the tendons and they are cut here, whereas here they are present all the tendons. This is the superficial arch by the ulnar artery, whereas this is the deep palmar arch by the radial artery. This is a deep palmar arch is completed by, see here, this is the ulnar artery which is cut here, okay, only one branch is shown here to show the deep palmar arch. So this is going and then completing the deep arch.
Okay.
Clear? Okay. So now the axillary artery. Okay. So let me explain the axillary artery first. So axillary artery, I said it is present in the axilla. Okay. So this axillary artery divided by one more muscle, which from the pectoral region, which goes to the coracoid process of the scapula. Okay. That is called as pectoralis minor muscle. What is that? Pectoralis minor muscle. So this pectoralis minor muscle again divides the axillary into three parts. From the outer border of the first rib to the upper border of the pectoralis minor is the first part. Behind the muscle is the second part. And from the lower border of the pectoralis minor till to, you can say, the teres major muscle, the lower border of the teres major is the third part of the axillary artery. Three parts of the axillary artery by which muscle? Pectoralis minor muscle. Pectoralis minor muscle. This is the first rib. Up to here is the subclavian. From the rib to the muscle is the first part. Behind the muscle is the second part. Third part is from the lower border of the pectoralis minor till to the teres major is the third part. Okay, it gives on different branches. The first part, one branch. Second part, two branch. Third part, three branches. Just like the subclavian I told you. The first part, vertebral artery, then you have the thyrocervical trunk, and then internal thoracic artery, like that. Second part, you have the costocervical trunk. Third part, dorsal scapular artery. That is the branches from subclavian. Whereas the branches from the axillary, the first part, one branch. What is that one first branch? You have the long thoracic artery. What is that? Long thoracic artery, which also again runs downwards, and then mainly supplies the mammary gland and area. Okay. Second part, two branches. What are they? Number one, lateral thoracic. What is that? Lateral thoracic. First one is long thoracic.
Yes.
Second part, lateral thoracic, and you have the thoracoacromial artery. What is that? Thoracoacromial artery. Thoracoacromial artery. These are the two branches from the second part of the axillary artery. Lateral thoracic again runs over the pectoral region, supplies the breast as well as the pectoral area along with the long thoracic. That is the pectoralis major muscle, pectoralis minor muscle, including the breast. They are supplied by these branches. What are they? Long thoracic and lateral thoracic. Thoracoacromial. That means it supplies the thorax area as well as acromial area here. This part, the acromion process of the scapula. There. Okay. So that is the second part branches. Then third part you have three branches. What are they? Number one is subscapular. What is that? Subscapular, which runs on the anterior side of the scapula along the subscapularis muscle. Okay. And then second branch is anterior, and third is posterior circumflex humeral arteries. What are they? Anterior and posterior circumflex humeral. That means what? Circumflex the humerus around the shoulder joint here. One goes anterior and one goes posterior. Both they circumscribe the humerus. So surrounding the neck of the humerus along with the axillary nerve. Very important, I told you, the surgical neck of the axillary nerve. Whenever there is any injury to that, you will have the paralysis of deltoid muscle and all. Okay. So these are the three branches from third part of the axillary. Okay. So first branch, I repeat, long thoracic. Second part, lateral thoracic, thoracoacromial. Third part, subscapular, anterior and posterior circumflex humeral. So these are the branches from axillary artery. How it is divided? By the pectoralis minor muscle. Clear? Okay. So these vessels, especially you have the what is that? The branches of this axillary artery and branches of the subclavian, they make an anastomosis around the scapula here. If there is any blockade in any of the vessel, so there will be collateral root. So because subclavian artery branches, axillary artery branches, they anastomose. Clear? Especially the first part of the subclavian and third part of the axillary artery, they anastomose the branches around the scapula. That we call it as anastomosis around the scapula. Okay. I said the subclavian branches like deep cervical, transverse cervical, suprascapular, dorsal scapular. They are all the branches from subclavian. So they all go to scapular region, and these subscapular branches mainly, the acromial branches, they also move to scapular side, and they will all anastomose. Okay, so that making an collateral root whenever there is any block in the area. Okay, so that is about the axillary artery, okay, which is there in the axilla. And after the crossing of the teres major muscle, then enters the arm. The same artery enters the arm. So that artery here we call it as brachial artery, because this is the reason brachium we say it as arm. So here the same artery is called as, it is same single artery, different region, different name. In the root of the neck area we call it as subclavian. In the axilla we call it as axillary. If it enters the arm we call it as brachial. Only single artery, given different name. Here it is called as subclavian, here it is called as axillary, here it is called as brachial artery. Clear? So it enters the medial side of the arm. It is superficial here. That means below the skin, not covered by muscles. That's why we choose the brachial artery to measure the blood pressure. Why do you choose the brachial artery? Because it is more superficial compared to other arteries. Whereas other arteries, they are more deep. And it's a big vessel, okay, nearer to the heart. And it is very easy to occlude it by inflating a cuff. If it is deep below the muscles, it becomes difficult for you to occlude the artery by inflating the cuff, right? That's why the brachial artery is chosen to measure the blood pressure. What is the anatomical reason behind it? Why it is chosen?
Superficial.
Because it is superficial and easily occluded and nearer to the heart. Clear? So that is the brachial artery. And then from the medial side, it comes to the anterior side. See here.
This one.
Yeah, you can make it. This is more specific, okay? So this is on the medial side, right?
Yes.
Okay? And then it comes on the anterior side.
Which one
in front
different?
of the elbow. This is the brachial artery.
Okay.
Okay? Here. So this is
Divide
the
into-
brachial artery, yeah?
Then divide into.
Then divide into, this is the
Radial
artery and this is the ulnar artery. Clear?
Yes.
So here it is marked. What is this artery? This is the radial artery. Okay? So this is the radial artery and this is the ulnar artery. Okay? So this ulnar artery gives one branch which goes deep. See here? This is one more artery. Can you see that? This is the anterior interosseous artery. Similarly, posteriorly, posterior interosseous artery.
Okay.
It is gives a small branch, as I said, the common interosseous artery, which divides into anterior and posterior. One in the you have the forearm divided into anterior compartment and posterior compartment. Between the radius and ulna, you have a membrane that is called as interosseous membrane. One runs, if consider this as membrane, okay, which is between the radius and ulna. So the artery is like this. This is the anterior interosseous artery. This is the posterior interosseous. Posterior interosseous supplying the posterior compartment, anterior supplying the anterior compartment of the forearm.
Separated by the interosseous membrane.
Interosseous membrane. That's why it is called as common interosseous, then anterior interosseous and posterior interosseous. So that's the branches in the forearm by the ulnar artery. Okay.
The common is the anterior aspect or posterior aspect?
Common is common here in the anterior aspect only.
At the
It
anterior
goes.
aspect.
If you think this is the membrane, this is the membrane.
Yeah.
So it goes the common interosseous. It goes like this and divides like this. Anterior and posterior. Okay. Yeah. So next continuous story. This ulnar artery, after giving many muscular branches here in the forearm, it enters the palm.
Palm, yes.
It
Make
enters
arch.
the palm, superficial to retinaculum. This is the flexor retinaculum. Superficial to retinaculum, enters the palm and then forms an arch. Okay, that is called as superficial palmar arch, completed by a branch from the radial artery. And from this palmar arch, you have the vessels given off. They are called as the common palmar digital branches. What they are called as? Common palmar, because these arteries are in the palm.
Yeah.
Common palmar,
Digital.
okay, digital branches, and this divides into proper digital branches. See here, one, and then which goes to the adjacent sides of the digits. So this is dividing into proper digital branches. What is that? Proper digital branches. Same thing with the deep arch also. Same, again palmar, metacarpal arteries we say, then they have that divides into the digital branches, proper digital. And there is communication between these vessels, the common from the superficial palmar arch and then even from the deep palmar arch. If you consider this as superficial palmar arch and this as deep palmar arch, okay. So you have common like this, which are dividing into proper.
Yes.
Okay. Similarly, the deep palmar arch also gives common,
Then proper.
and this also divides into deeper. What is that? Proper. Okay. So now these are the common from deep arch and these are the common from superficial arch. There is communication between them like this. Okay. So that if there is any problem with the ulnar artery here, the blood from the radial artery will supply the digits, like that. So everywhere there is anastomosis. Okay. So that is about the superficial palm arch found by radial artery, ulnar artery completed by radial artery. Deep palm arch found by radial artery completed by ulnar artery. Clear? Yeah. So now the radial artery is very important here at this region, just behind the thumb, where it is directly lying on the bone. That is the radius. Okay, where you feel the pulsation, the pulse rate, where it is calculated. It is by the radial artery. You feel the pulsation, peripheral arterial pulsations, where when the artery is directly lying over the bone. Because you can press the artery over the hard surface of the bone and then measure the rate, even the volume of the also. Volume also, like here in the radial artery, where it is very easily accessible to the physician, and even you can measure here at the carotid artery, the femoral artery, the dorsalis pedis artery. Many sites are there in the body where you feel the pulsations. But this is chosen because it is very easily accessible to the physician. Okay, but going to the neck is difficult. Okay, so that's why radial artery is chosen to count the pulse rate. Or the heart rate.
Exactly, Doctor?
You can make it in your hand. Don't use the thumb to measure the pulse
the
rate.
third one.
You have to use these two.
Yes.
Okay? You can feel it in your own. You feel or not. Just behind the thumb. Anterior side. You have to press a little.
Here?
Yeah. You didn't find? No? Okay.
There's this method.
Yeah.
Yeah, you can use this method. It's like this.
You feel? Anterior side. Press on the bone.
yeah.
Not on the muscles. Just lateral to these tendons. There are tendons
Yes.
here. So lateral to that. Press there. Yeah.
Yes.
You felt
I
it?
found it.
Yeah. So that is the radial pulse. Radial pulse. From here it winds round and then goes to the dorsal side and pierces between the thumb and the index finger and then goes deep and then forms the deep palmar arch. Clear? So this is the story about the arteries in the upper limb. I told you only about the arteries.
Yes.
I told you about the arteries. So I repeat, the axillary artery begins from the outer border of the first rib till to the lower border of the teres major muscle. Okay, that is the length of the axillary artery within the axilla.
Yes.
So this axillary artery is divided by the pectoralis minor muscle into three parts.
Each one.
The first part, one branch, second part, two branch, third part, three branches. Okay, first part, what is the branch? Long thoracic. So which runs downwards in the thorax, as the name only indicates,
Yes.
it supplies the thoracic area. Okay, there are the pectoral muscles and even the mammary gland also. And then
Lateral thoracic.
lateral thoracic and thoracoacromial. Okay, third part, three branches, two circumflex, anterior and posterior, one is subscapular,
Subscapular.
which goes to the scapular region and makes anastomosis with the subclavian artery branches. That is anastomosis around the scapula. Anterior and posterior circumflex wind around the neck of the humerus. Okay, and then supply that shoulder area. Okay, and rest of the artery continues as brachial artery. So here the brachial artery gives many muscular branches which supply the anterior compartment, and here the brachial artery gives one big branch which goes posterior. That is the profunda brachii artery. What is that? Which supplies the back of the arm. What is that? Profunda means what? Bigger. Brachii is the arm. Profunda brachii artery, that is the big artery which runs along with your, you can see it here. See there? Which runs along with the radial nerve. So this is what is the profunda brachii artery. Profunda brachii artery. See the inside? So this is the profunda brachii artery given off from the radial, what is that? Brachial artery. This is the brachial artery. Okay? With one branch which goes posteriorly and then supplies the posterior compartment. Okay? So here and anywhere in the body around the joints there is always anastomosis of the vessels. Anastomosis of the vessels around the joints to keep the distal part of the limb vascularized during the movements of the joint.
Doctor, there's one thing I didn't. It's not clear for me. You said there is anastomosis anywhere. All of our body has anastomosis, but
Yeah.
anatomically, not functionally.
No, everywhere it is, I mean, functionally and even anatomically also. Which one?
First here.
It is to Dr. Shivan, I am not the organizer.
Okay, I'm sorry.
Yeah. Okay? Everywhere there is they are functional anastomosis. Only in the heart,
On the
somewhere.
heart only anatomical.
Yeah, only anatomical, but not functional. Not everywhere it is, not that it is functionally anastomosis.
Yeah, because of that.
Okay? Yeah. So, here from the brachial artery you have branches called as collateral branches which run towards the elbow joint. Collateral means which run along with the collateral, that is the brachial artery. Collateral with the brachial artery. And then you have the branches which are called as, which run upwards from the radial as well as the ulnar artery. They are called as recurrent branches. Collateral, recurrent. Because they run upwards, reverse the course. So these collaterals and recurrent, they make anastomosis around the elbow joint. Clear? Like ulnar collateral arteries, the radial collateral arteries. Ulnar recurrent arteries, radial recurrent arteries. They make anastomosis around the joint.
Okay.
Clear?
Yes.
So similarly around the wrist also.
Wrist, okay.
So everywhere you have the anastomosis around the joints. Okay? Yes. So that is the story about the arterial supply of the upper limb. Now comes to the veins. Anywhere in the body you know that there are two groups of veins. One are the superficial veins and one are the deep veins. So deep veins, they are run along with the arteries. That's why they are called as vena comitants. They run with the arteries. They run with the arteries and they are named as the vein running along with the brachial artery, brachial vein. Along with the radial artery, radial vein. Along with the ulnar artery, ulnar vein. Axillary artery, axillary vein. Subclavian artery, subclavian vein. They are all deep veins. Whereas superficial veins, they are named. Only some important. There are many, plenty of veins. But only many big veins are named. Like from the upper limb, on the dorsum of the hand, you have a venous arch. Venous arch. Like this. There is an arch. Just like the arterial arch, there is a venous arch. Okay. From this venous arch, okay, you have two veins beginning. On the lateral side, you have the vein called as cephalic vein. What is that called as? Cephalic vein. From the medial side, you have a vein called as basilic vein. What is that? This is the basilic vein which runs along the medial side. Okay, runs here, and at the middle of the arm, it goes deep. And joins with the brachial vein, which is running along with the brachial artery, and then forms the axillary vein, which runs in the axilla. Whereas cephalic vein, it runs here. While it is running, it receives many tributaries. Okay, it runs along the lateral side, goes along the deltoid here, and then comes here, and then between the deltoid and the pectoral, that is the clavicle, clavipectoral fascia, it pierces and then enters the axillary vein. Whereas basilic becomes deep here only, whereas cephalic here.
What's another name? Cephalic artery?
Basilic. B-A-S-I-L-S. Basilic. Okay. So medial side basilic vein, lateral side cephalic vein. And very importantly here, it's the cubital fossa in front of the elbow. So this basilic vein and the cephalic vein, they are connected. A big vein that is called as the median cubital vein. What is that called as? Median cubital vein. Very important, this vein. Okay. Because that is the vein which is usually chosen to draw the blood. To draw the blood for investigative purposes, okay, for diagnostic purposes. Why that vein is chosen? Because it is fixed. Because all the superficial veins, they will be moving. When you want to puncture that, they will move. Okay, you will not be able to go into the vein. Whereas this vein is fixed by the bicipital aponeurosis. The biceps muscle, its tendon forms an aponeurosis in which the vein is fixed so that it won't move when you prick the vein. Okay, that is the median cubital vein having clinical importance, which connects basilic vein on the medial side, cephalic vein on the lateral side. So this is the story about the veins of the upper limb. Whereas deep veins, as I said, ulnar vein, radial vein, they join together to form brachial vein, which runs along with the brachial artery. This brachial vein joins with the basilic vein, then forms the axillary vein. Clear?
Clear.
Yes. So that is the story about the upper limb. I just try to show you all those already shown you. So maybe in this model. So this is what is the axillary artery here. Okay, axillary artery then continues as the brachial artery. This is the brachial artery. Okay, so then this brachial artery, this is along the medial side. Okay, then comes to anterior side here. Okay, and dividing into ulnar artery and then the radial artery. Radial artery on the lateral side, thumb side, ulnar artery on the little finger side, that is the medial side. So this ulnar artery is giving, see here, this is what is the common intraosseous artery. Okay, dividing into, this is the anterior intraosseous, and this is the one which is going posteriorly. Okay, that is the posterior interosseous artery. This is the anterior interosseous artery. Clear?
Yes.
And this is the ulnar artery going and forming superficial palmar arch.
Yeah.
Superficial palmar arch.
Which radial?
Ulnar.
Yes.
Superficial
Because
palmar
radial
arch.
okay.
So radial will go posterior. See here, it is going deep here.
Yes.
It goes deep and then forms the deep arch.
Okay.
So it gives the radial artery gives two branches. There is arteria princeps pollicis for the thumb and arteria princeps indicis for the index finger. Okay. Yeah. I am not. I wanted to show you the posterior interosseous, which is not clear here. Okay.
The profunda is it seen, doctor?
Yeah. Okay, it's not much clear here. You can consider this as your profunda brachii artery. Okay, it's not much clear here, but you can see it very clearly in this specimen. You see there?
Can you turn it up?
Inside you can see the red. This is what is the radial nerve.
Okay.
Okay, so inside you can see the red. That is the profunda brachii artery. Profunda brachii artery, which supplies the posterior compartment of the arm. Okay,
It's a branch from brachia.
brachial. Yeah. So that is the story about the artery of the upper limb. So now go to the lower limb. So you know that lower limbs. So the thoracic aorta runs down. This is the diaphragm. Okay, thoracic aorta runs downwards and then forms the abdominal aorta. So this abdominal aorta divides into
Common iliac.
common iliac arteries within the pelvic area. Okay, that the rim of your pelvis, this in turn divides into internal iliac and then external iliac. This internal iliac supplies mainly the pelvic area and even few branches even the gluteal area, whereas external iliac runs downwards. What is this ligament you have here? It is the inguinal ligament. It runs behind the mid-inguinal point, and then comes to thigh as femoral artery. What is the femoral artery? It is the continuation of external iliac artery. And then comes to thigh. It is there in the femoral triangle and runs in the adductor canal, and from there it gives many perforating branches which will go to the posterior compartment of the thigh. The perforators, you know, the adductor magnus is having a long tendon which is attached to the femur. In that tendon you have many holes. Okay, the hiatus openings. Through them the branches will go. Okay, they are called as perforators and they will supply the back of the thigh. Okay, and the last hole, the femoral artery goes behind the knee as popliteal artery. So popliteal artery behind the knee. This popliteal artery divides into two branches. One is the anterior tibial and one is the posterior tibial. Anterior tibial will go for anterior compartment of the leg. Posterior tibial will go for posterior compartment of the leg. And posterior tibial gives one more branch that is called as peroneal, which goes in the lateral. So the leg is having three compartments. Thigh is having two compartments. Even you can say the three compartments here in the thigh also. The medial compartment of the thigh, anterior compartment of the thigh, posterior compartment of the thigh. Whereas leg, so if we consider this as the thigh, okay, so this is the anterior compartment and this is the medial compartment and this is the posterior compartment. This is the anterior, medial and posterior compartment. This is the thigh cut section. Anterior compartment, posterior compartment and medial compartment. Okay, so anterior compartment directly branches from the femoral artery. Okay, this is the femoral artery. And the posterior compartment, from here, this artery only, there are perforators. Like this. Okay, they form the perforators which supply the posterior compartment. Okay, and this medial compartment is supplied by a separate artery which passes through your obturator foramen in the hip bone. Okay, that is called as obturator artery, which is a branch from internal iliac. Which is a branch from internal iliac, not external iliac. This is the internal iliac gives one branch that passes through the obturator foramen and then goes to medial compartment of the thigh. That is the obturator artery. And there are even few branches from the internal carotid like superior gluteal. inferior gluteal, which goes to the gluteal region and then supply. Okay, and now this continuation, this is the inguinal ligament if you consider. Okay, this is called as the femoral artery. Okay, this femoral artery runs downwards. Okay, in then the adductor canal, and it gives perforating branches which supply the posterior compartment, and at the last hole the artery itself passes and then runs posteriorly as popliteal artery.
The
Popliteal artery divides into anterior tibial and posterior tibial. Anterior tibial, anterior compartment of the leg. Posterior tibial, posterior compartment. This posterior tibial gives one branch which supplies the lateral. If you consider this as the cut section of the leg, okay, so this is divided into three regions. Okay, the anterior compartment, the lateral compartment, and this is the posterior compartment. So lateral peroneal artery, which is a branch from posterior tibial. Anterior tibial artery, anterior compartment. Posterior tibial artery, posterior compartment. Clear?
about the thigh, doctor.
Thigh, medial obturator artery, branch from internal iliac. Okay, the anterior compartment, direct femoral artery branches. The posterior compartment, the perforating branches from the femoral itself. Femoral itself. Okay. So later, after supplying all this anterior and posterior compartment, the femoral artery itself goes to the back of the knee as popliteal artery. The continuation of femoral is popliteal artery, which branches at the behind the knee, okay, into two, anterior and posterior. Similar to your ulna and radius, you have interosseous membrane. Between the leg is having two bones, tibia and fibula. Okay, there also there is interosseous membrane. This popliteal goes at the membrane, divides into two. Okay, then is anterior tibial and one is posterior tibial. This posterior tibial even it gives a branch which goes to lateral compartment. Clear? Yes. So now this anterior tibial, after supplying the anterior compartment of the leg, okay, after supplying the, can you see this? This is the anterior tibial artery. Okay, from the popliteal artery back. So after supplying this anterior compartment, then it goes in front of the ankle.
Okay.
In front of the ankle, and then comes to the dorsum of the foot, where here it is not shown. Okay, the continuation of the anterior tibial artery over the foot, dorsum of the foot, is called as dorsalis pedis artery. What is that? Dorsalis pedis artery, which pierces the space between the great toe and then the second toe. Okay, and then goes deep. So here this artery can be felt over the navicular bone, one of the bone of the tarsal bone, navicular bone. So there also the dorsalis pedis artery can be felt. You can feel in your own foot, dorsalis pedis artery. So you might have learnt in your the clinical skills lab. Okay, dorsalis pedis artery. Okay, that is one of the peripheral artery pulsation you must feel whenever the patient comes to you with this history of the arterial diseases, especially the chronic smokers and all. I think you had one the clinical skills or the PBL.
Yeah, we have.
Where the gangrene there you asked you to feel even the pulsations of the peripheral arteries. Okay, here. So that is the story about anterior tibial. And now posterior tibial continues behind the medial malleoli. I will show you the posterior tibial also. So this is the posterior tibial.
Okay.
Okay, continues behind the medial malleolus. Okay, here as the medial plantar artery. What is that? Medial plantar artery, and then goes to the foot and supplies majority of the structures in the sole of the foot, again by making arches, just like the palmar arches in the hand. Here also it makes plantar arches. Plantar arches. So posterior tibial continues as medial plantar, whereas peroneal it continues as peroneal continues as the lateral plantar artery. The peroneal. On the lateral compartment, it goes behind the lateral malleoli and again enters the sole of the foot as lateral plantar artery. But much of the supply to the foot is by medial. Okay, and even by the dorsalis pedis artery. Okay. Clear? So that is about the arteries in the leg. I can show you here. See there? This is the femoral artery. Femoral artery here. So the femoral vein, the artery, and then the nerve. Obturator, I think, is not here.
It's going from
see here. So this is what is the adductor canal.
Okay.
Adductor Canal. So this is the femoral artery. From here, the deep inside, there will be branches, perforating branches, which are here. So these are all some of the perforating branches. At last, it is piercing the last hole in the adductor magnus and then coming posteriorly. This is called as the popliteal artery.
Okay.
This is the popliteal artery. The femoral artery only piercing and then going back as popliteal artery. This popliteal artery behind the dividing into posterior tibial and anterior tibial.
Okay.
Clear?
Yes.
This is the story about the femoral artery. Here the femoral artery gives many branches. Like superficial epigastric, you will learn them in your lectures. Okay, superficial external pudendal artery, the perforating branches, muscular branches. Okay, deep artery of the thigh. All those branches are there, which will be supplying everything in the neck. That is, thigh, anterior compartment as well as posterior compartment. Whereas medial is supplied by the obturator artery, which is not there here. Okay, the medial compartment muscles are supplied by obturator artery. Whereas gluteal region by gluteal artery branch, that is branches of the internal iliac and as well as the branches from the femoral artery also. Like superficial epigastric, what is that? External iliac, which runs along the iliac bone femoral artery branches.
From external.
Continuation it is.
External iliac. How about internal iliac?
Internal iliac is a common iliac dividing into external and internal.
Okay.
So external continues as femoral. Internal iliac artery remains within the pelvis, supplying all the pelvic structures. Like urinary bladder is there. There are many other structures like uterus is there, ureters are there. They are all supplied there. Urinary diaphragm is there. They all will be supplied by. The rectum is there. They are all supplied by the branches of the internal iliac artery. This is the mainly artery of the pelvis. Okay, and even the perineum, like the scrotum, testis. Then you have the not the testis. You have the penis. They are all supplied by the branches from the internal iliac. Okay. So whereas external iliac is mainly the
femoral,
the thigh, the lower limbs. Okay, continues as the femoral. Is that clear?
Yes.
So that is about the arteries. That is about the arteries of the lower limb. And now come to the venous drainage. It's a very important point clinically. The venous drainage of the lower limb. Because of many persons, especially the guys who are standing for a long time, especially the traffic police and all, they suffer from the disease of the veins of the lower limb. This is called as varicose veins. You might have heard of that. Very tortuous veins on the lower limb. That is called as varicose veins.
From standing.
Yeah, long time standing. Because here the vein has to flow against the gravity. Against the gravity. Okay? There is no much pressure in the veins, so that it will move above to the heart against the gravity. Against the gravity. The deep veins are there. Okay. So deep veins, what is there? They are surrounding the muscles. When there is a contraction of these all, especially the calf muscles, it acts like a heart, calf muscles. Okay. And then they call it as peripheral heart because of that pumping. The venous blood flows in the deep veins. But superficial veins, it becomes difficult to follow that. But so continuous long standing, the blood starts stagnating within the veins, giving rise to tortuosity, swelled veins. Okay, that condition is called as varicose veins. So the superficial veins are named. You have two important veins. One is the great saphenous vein, and the other is the small saphenous vein. So similar to the dorsal venous arch, the dorsal plantar arch on the foot here. Okay, there is one more arch here formed. One more arch formed here. So from the medial end of the arch, you have the great saphenous vein running. Okay. From the lateral end of the arch, you have the short saphenous vein ending running. So short saphenous vein runs on the lateral side and then goes to posterior side of the leg and then joins the deep vein, that is the popliteal vein, along with the popliteal artery. Okay. Whereas great saphenous vein, the longest vein in the body. Longest vein in the body begins from the medial side of the arch and then runs in front of the medial malleolus, runs upwards on the medial side of the leg and even thigh, and then here at the saphenous opening it pierces and then drains into deep vein, that is the femoral vein. Femoral vein. So now these superficial veins are valved. They have valves inside. All the veins you have, you know that they have valves inside. They will allow the venous blood only one way. Because of the walls, the blood is moving up, not down. Because they will allow only the upward flow of the blood. They will not allow the lower downward. If there is any deformity or any pathology in the walls, then he will have varicose veins. Clear? And there are veins which are connecting the superficial and the deep veins. There are superficial veins and then the deep veins. Connecting superficial and deep veins, there are connections. They are called as perforators. They are called as perforators. Okay? Yes. So I can show you here. See here, very big vein. This is what is, I think. No. You can see it here. This is the. See here. This is the long saphenous vein or the great saphenous vein. See, so long it is. Okay. So it begins from the medial end of the arch, runs in. This is the medial malleoli. Runs in front of the medial malleoli, running upwards on the medial side of the leg, and then the medial side of the thigh, and then goes and opens into the femoral vein deep there. Clear? This is what is the long saphenous vein or the great saphenous vein. The short is not much clear here. Okay. So which drains into your
Is this short?
the no, that's, I don't think so. That is the popliteal vein. It drains. Okay. Part of it is not much clear. Okay, leave about that. This is because it's coming from the nerve. Okay, so you can see here only the long saphenous vein here. Okay, so any defect in the valves or in the perforators which are connecting the superficial and deep veins, any deformity in them, so it will give rise to a condition called as the varicose veins. So as I said, the deep veins, they always run with the arteries, like posterior tibial vein, artery, posterior tibial vein, anterior tibial artery, anterior tibial vein, peroneal artery, peroneal vein, popliteal artery, popliteal vein, femoral artery, femoral vein, like that. Then they form the external iliac vein, then common iliac vein, then join from the both common iliac vein join to form inferior vena cava, like that. Clear? Now that is the story about the blood supply of the lower limb. Okay, so I can show you here the femoral artery. I can, because the skin is not removed, to show you the femoral artery.
From here, this one, Doctor. Is it
Yeah.
Is it this one?
See, yeah, you can see it here. This is what is the femoral triangle. See this? So this is what is the femoral artery, big vessel. See here. This is the femoral artery. Clear? This one. This is the femoral artery. Whereas posteriorly, you can find. This is what is the popliteal artery. What is that? Popliteal artery. No, not and yeah. And it's the popliteal vein, popliteal artery, and then popliteal vein. And this is running downwards.
The most superficial
So this is what is
artery.
the posterior tibial. Continuing behind the medialis and then running as medial plantar. Okay, this is the posterior tibial.
How about anterior tibial?
Anterior tibial, actually it will be a little deeper. No, not here. Difficult to demonstrate a little bit. Not dissected because this is the specimen just to show you the muscles here. Okay. Okay. I showed you in this specimen, no?
Yeah.
It is deeper to muscles. That's why it's a little difficult. So here,
Yeah,
after
this-
taking out the muscle, you can see the anterior tibial, just like that. So the muscles will be covering the artery. Okay. So this is the anterior tibial artery. Okay. This is the posterior tibial. Again, deep. Okay. And continuing behind the medial malleolus, the medial plantar artery. Okay.
For the bypass surgery graft, Doctor, they used to take from
Saphenous vein,
yeah.
The great or small?
which is easily accessible. Usually they take great saphenous veins. They take the venous graft, they cut the veins from there and then reverse it, so that because there are walls.
Cephalus, from the cephalus.
Yeah.
They take-
Saphenous.
From cephalus they take.
Yeah.
They
Yeah.
take.
Yeah.
Okay, then how they will connect it again?
Because there are many tributaries, they will drain that area. Don't think that if there is any cut here, the saphenous vein is cut, then venous blood will not flow upward. There are other veins which will be get activated, and then they will carry the venous blood. For example, if there is a cut here,
Okay.
if the vein is cut here, okay, so then do you think that the venous blood from this area will not move? There are other channels, no, which will take up the blood, like that. So that's all about the, what is that? Blood supply of your upper limb, lower limb, and the heart in brief. Clear? Okay.
Thank you.